I did a lot of work with veterans and service members, but I've also done a lot of work in the private sector also. So I've worked with both.
'Cause, there's an immense amount of trauma with, you know, military
Oh,
and things like that. I'm just
absolutely.
curious, is there, besides, the support groups and stuff, is there, other tactics that you use to help people with like severe trauma?
Yeah, so I would say really when we talk about PTSD and we talk about treatment options, where we are right now, kind of in the field of trauma and with PTSD treatment, is we're in a pretty solid place. We have we have several evidence-based therapies for PTSD. And so let me back up 1 second. One thing that's really important for people to understand, and I feel like this is something I can never stress enough, is that a lot of times I think there's a lot of kind of misconceptions about therapy. I think sometimes people really view it as simply, a supportive conversation, somebody who's listened to you and can be empathic, and you kind of have the floor, and that's that therapist is there really is your support. I think the flip side is sometimes there really is this idea that therapy is this sort of mystical, mysterious, like we don't know what happens, but somehow somebody manages to get better. The truth is, therapy is a science. It truly is a science. And what we've seen within our field, and especially in the area of PTSD, is we have several evidence-based treatments. And what that means is these are therapies that have been researched and backed by science. They have been proven to be effective. And the reason pursuing or investigating an evidence-based treatment is so critical is because when we say that these are evidence-based, this isn't just like, oh, there were a few studies and people got better. These are true scientific studies, similar to the types that we would run on, like FDA does on drug approval. We're looking at randomized controlled trials. We're looking at studies that have been done that where, it's a blind study to reduce prejudice. If they're going to be published in well peer-reviewed journals. Essentially, we have a committee of experts who really kind of kicks the tire on that study to make sure the design was solid, it was implemented correctly, those results are valid before they get published. So when we talk about an evidence-based study, it is truly a therapy that has been proven to be effective by science. And when you choose to participate in an evidence-based therapy that's been proven to be effective, it's not just possible that you're going to get better, it's highly probable that you're going to get better. And so I just can't emphasize that piece enough. Whether you're treating trauma or grief or anxiety or OCD, please look into evidence-based treatments. With regards to PTSD specifically, two of our leading evidence-based treatments right now, and these are what we consider our first-line treatments, are cognitive processing therapy and prolonged exposure therapy. And those two treatments that I've been doing for over 20 years, both as a clinician and training and providing consultation for clinicians learning these treatments. I worked with the National Center for PTSD's their prolonged exposure therapy program for 16 years as an expert consultant and provided, clinical oversight and guidance to VA therapists that were learning this treatment. These treatments have been found to be more effective in treating PTSD than medication and other types of PTSD therapies. So I would say that's the other thing, especially for individuals with fairly severe PTSD or have been struggling with it for quite some time. Really considering one of these first line treatments is probably about your best foot forward in terms of trying to promote recovery as quickly as possible.
Yeah,
Yeah, I think that's a huge takeaway, Megan. I think that it's really important for people to hear that, and that it's. I really loved what you spoke to about the evidence-based treatments. Thank you for reminding people that this isn't a perfect journey necessarily. It's tailored to the individual, and it's not about pretending, right? It's really just about getting what treatment works for you.
There's every reason to be hopeful that if you engage in an effective treatment, you're going to get better. You're going to see positive changes, usually sometimes even within a matter of weeks to a month. And so I think that is something that just simply isn't, that is not enough a part of our national dialogue around mental health. I would think we're very good now at recognizing the problems. We're not as great about really advocating and promoting the solutions. And that's that with evidence-based treatment, you have incredibly solid treatment options that promote recovery.